The statistics paint a sobering and grim picture. By 2021, spending on medical services is expected to reach almost 20% of U.S. gross domestic product. 1/3 of U.S. primary care providers report the amount of time they spend coordinating care is a major problem.
Patients are often referred to us with only scanty information sent to us by their referring physicians. Some patients have very poor knowledge of their past medical history, and some people don't even know why they were referred to our office.
There's a lot more going on with a patient with their medical care, and a lot of things happen outside of the health center.
The paper results are almost a crushing burden on the practice at this point in time. We're probably wasting somewhere in the neighborhood of 24 to 32 hours a day filing paper.
Who is helping overcome these challenges? HIXNY is the Healthcare Information Exchange of New York.
Saratoga Hospital has supported HIXNY from the beginning. What started out in somewhat of a competitive environment, I think has evolved very nicely into one in which there's a lot of collaboration.
I got to know some of the folks that were involved in HIXNY, and they were all the people that I worked with in the Capital Region for many years.
I trust HIXNY in my daily practice. With HIXNY, the important thing for us is that we're often open when other doctors' offices aren't open, Saturdays and evenings, and we're able to obtain information from their provider to help with their medical care.
We're moving from fragmented care that's acute and episodic and really understanding the comprehensive nature of what goes on in between patient visits. HIXNY is our one-stop shop.
By having information available and being able to exchange that information on behalf of the patient, it just pulls everyone together. It pulls a virtual team of people together. It's about coordinating care. It's about connecting the dots for patients.
As a primary care physician, we're able to access the information. Also, the specialists are able to access the same information. Together, we can make decisions that are relevant and timely at the point of care.
I think HIXNY is a great thing. My daughter, she sees many different specialists. It's so vital that everybody's on the same page with where she is in her health.
We know our patients see lots of different doctors, go to lots of different facilities, and we need, if we're going to truly coordinate their care, to have information from everywhere. For us, that's HIXNY.
Adverse drug interactions can be deadly. Through HIXNY, I can find out quickly their medication list and move forward with the appropriate therapeutics in a safe manner.
One life-saving example that we have is from a patient who came in with significant bleeding. They were unable to give us a history of any medication use. Our provider was able to look into HIXNY and really improve that patient's care and probably contribute to saving their life.
I would say that HIXNY has saved Dr. Masder about $7,000 annually in staffing costs.
CDPHP has been working with HIXNY since its inception. Primarily in the last 2 years, we've had a focused program on connecting our enhanced primary care providers and our medical home neighborhood specialists. We're proud of the work that we do with HIXNY. These providers are improving the quality of care they're giving to our members and reducing costs.
Healthcare costs are often the second largest expense after payroll for businesses across the board. A robust electronic health information exchange will not only improve care, but it will lower costs for employers and employees.
With healthcare customers in more than 100 countries around the world, InterSystems has a unique vantage point. As I see it, there are two things that are key. The first is to engage your entire community. The second is to be able to deliver to clinicians the information that they need, when, where, and how they need it, and without disrupting their practice of medicine. HIXNY has successfully addressed these challenges, and it's one reason that I think you're getting so much attention from around the world.
HIXNY is a trusted collaborative.
HIXNY is creating a connected healthcare community.
HIXNY is peace of mind.
HIXNY is making medical care better for everyone.
HIXNY is information sharing to coordinate care.
HIXNY is the window to my patient's medical life.
HIXNY is transforming patient care.
HIXNY has improved patient safety.
HIXNY is our one-stop shop for care coordination.
HIXNY is containing cost for small practices.
HIXNY is creating value in a connected community.
HIXNY is a great partner and a leader in connected care.
HIXNY is saving lives.
HIXNY is high-tech healthcare for Tech Valley.
HIXNY's the future.
HIXNY is all of this and all of you.
And I am HIXNY.
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 I'm Tabitha Sullivan, and this is my daughter Isabel, and we are HIXNY.